And moving on at 7:32 Friday morning, we are continuing the discussion on the COVID-19 vaccine and the importance of staying informed. As you ask, we answer. We're joined once again by Trinity Health of New England's Dr. Syed Hussain. Dr. Hussain, good morning. So glad to see you.
Morning. Thank you for having me.
All right, a lot of talk about Pfizer's vaccine for kids ages 5 to 11. It is expected to get emergency authorization next week. What do you say to parents who are hesitant to get their kids vaccinated? This is huge.
This is big, and we expect the CDC to weigh in and give the green light early next week, following which we'll be able to start vaccinating. For parents out there, please know that this is safe. This is a third of the adult dose. And in the study data that Pfizer submitted to the FDA and CDC, there were minimal, if any, side effects. And this is this age group, 5 to 11 years old, is the largest group in the U.S. remaining that is not yet eligible. It's 28 million children that we're looking at. We've seen over the last several weeks across the summer, as the Delta variant spread, how many more children were impacted compared to any other period during this pandemic. So we know that we can keep our children safe, and this is a safe alternative and to prevent COVID-19. So please get your children vaccinated as soon as the approval comes through.
Now, you did mention symptoms similar to what adults saw. So just recap those for parents. They might be concerned about what their kids are going to have to go through.
So in adults, we saw body aches, chills, joint aches, and it doesn't last more than 24 to 48 hours. I'm eager to see how the CDC's Advisory Committee on Immunization Practices weighs in and gives recommendations. So we await those recommendations, but side effects are nothing compared to what some of the more severe complications are with COVID-19.
All right, now, doctor, the other big COVID news coming out this week is that the antidepressant drug that is extremely affordable, I mean, we're only talking about a few dollars, it's showing real promising results in helping to treat COVID-19. What do you think? This is a good option for people battling the virus?
Yeah, so this is a promising study, but one piece of caution here for viewers is that this is only one study out of Brazil, around 1,500 people. Brazil has had more severe disease and hospitalizations than other countries. So while promising, more studies are needed before we jump on this bandwagon and think, okay, this is a medication that will help us. What I'm more excited about and what I'm looking forward to is the pill developed by Merck, which is now with the FDA to weigh in and review data and perhaps lend approval, which would become the first oral pill to cure this, to fight this disease. And the Merck study was halted prematurely because the results were so promising and severe disease, hospitalization, and death was reduced by more than half.
All right. Yeah, definitely promising. Good news there. Dr. Hussain, thanks so much for being with us. Of course, we will certainly check back with you next week as we learn more about when the kid vaccination will be approved.